Welcome, welcome, welcome. Welcome to each of you. I'm Dr. Simmons. I'll be your facilitator for this training today. And before we get started, I just have a little disclaimer for you because our topic today is mental health strategies. And I want to let you know that I am Dr. Simmons. I'm not a medical doctor. And because I'm not a medical doctor, this is training for information only. This is not a prescription for your medical needs. And if you do feel that there's a need that need to be met, please contact your local physician for any of your medical needs. This is for information and training only. But we'd like to welcome each and every one of you here today. We have staff development training. This is part of our series. And why do we have staff development training? We have staff development training because we had to adhere to our contract and funders compliance. If you have a contract with any state or government agency or just a funding institution, there will be staff development training that will be important in that contract compliance. And we want to prepare each and every one of our staff for a higher level of responsibility. We want to improve the knowledge in our industry, and that's why we have these training for people to understand people better. We want to improve the knowledge of our company policies, procedures, and goals. And if you know that many times procedures change as time changes, as things evolve, laws change, we want to be in compliance to all of those needs and to enhance our training. Training encourages the employees to enhance their knowledge, boost their productivity, and their motivation. So why not improve good customer service? And when we do that, we have good customer service because we work together as a team. If you look at the team of people around the table, they're all from different walks of life, and that's why they're all different colors. But one thing for sure, is that the one with the blue piece of the puzzle will fit the puzzle and the puzzle will be complete. But we all take everybody into consideration as we learn how to work with it in a team environment. And it's very important because this helps us to serve our people better, serve our client better, serve others better. And that's one of the reasons why we have staff development training. Where May is Mental Health Awareness Month, every May. And I just want to put a plug out for mental health awareness and a National Alliance on Mental Health Illness. And this particular campaign is Take a Moment. I really like that slogan because we can celebrate mental health illness by taking a moment in May that we will encourage people to foster dialogue and to take a moment to participate in sharing resources to other people and other families. And you can participate by sharing the website www.nami.org, or you can participate by dialing the 1-800-950-6264. It is on the screen. Take a picture of the screen because it's important. This is May is Mental Health Awareness. I don't know when you're watching the video, but one thing for sure, if it's May is Mental Health Awareness Month, and we want you to participate by sharing resources to other people. Maybe if it's a client or a family member in need, you can contact them, go to the website, and there's tons of resource. So you can participate by taking a moment. I like that campaign slogan. Just take a moment of your life and share with some other people. Let's define and explain mental health. Why do we have mental health illness? It's on everybody's mind lately, and it's due to the recent pandemic. It led to global increase. We all had anxiety, depression, we have loss of loved ones or mood disorders. These were all mental health issues that created chaos in our society globally. Globally, it was so much happening. You didn't know, take a shot, don't take a shot. They would, or they don't have shots. It was just chaos everywhere, and it became a household word that mental health people have mental health issues, and a lot of it had negative conversations because it was so much anxiety. But we do know that there are people that may have some mental health issues that may pose to be a danger to themselves or others. and maybe they're not available or they don't know how to provide for their basic need, food, shelter, or clothing. And this is one of the reasons why we have such a large population of homelessness, and a lot of it is attributed to other mental health challenges, that they don't come inside for shelter. They don't know how to come in. They've been out for so long. So we need to understand and define mental health. And it's been a long journey of mental health, because the whole concept years ago, or not years ago, many seasons ago, I would say people were institutionalized for their mental health. But now they're moving it into the community. And now they're not going into institutions, they're living on the street. But there's several different views from our experts as they talk about how to create and introduce innovative, safer treatment methods. Because our ultimate goal, as we understand mental health and understand how it is defined and explained in our society, our goal is that we would make mental health a priority, without the guilt and the shame, and how it is important that everybody has an opportunity to live a healthy lifestyle. Many people wear a mask. You see the picture of the person with the mask and the smiling face. Are you wearing a mask? Are you not being your real self? What's behind the smiley face? Look, the person has tears in their eyes behind. We all have problems. As I said before, even when the pandemic, COVID-19, could be COVID-20, could be COVID-22, because we still deal with it. And a lot of people wear the mask because they don't process what's really going on, their fears, their sorrows, their tears. Instead, they wear the mask and they internalize and they stuff it. And when they internalize it, it can create even more problems. It can hinder you or that person. So I'm just saying, you don't have to wear a mask. It's possible for you to live a healthier life so that you're not overwhelmed with problems. You don't have to hide behind a mask or pretend to be happy when you're thinking or not feeling happy at all. There's always avenues for you, like the website I just gave you, www.nami.org. Or in case of emergency, if you need help, call 911 for emergencies. You don't have to live in a position that you have internalized your problem and haven't applied strategies for good health for mental health. You do not have to wear the mask. If you wear the mask, you're just internalizing what the problem is. So stop hiding behind the mask. Establish a strategy for a plan of action. Good mental health is always granted to you. It's available to you, but you have to develop a strategy for it. And in developing the strategy, our purpose is to have a plan of action designed to reach a goal. And when I think about reaching a goal, think about the end at the beginning. Think about it like a pyramid. At the top of the pyramid, let's say the stress is a mental health situation where you can't overcome a period of stress in your life, and that's at the top of the pyramid. And towards the bottom of the pyramid is just the action steps you take to reach your goal. How do you release that stress? How do you achieve that goal? So establish a strategy for good mental health. Don't just stuff it. And what can cause mental health problems? It can be caused by several things: childhood abuse, childhood trauma, adult trauma, social isolation, long term stress, and bereavement. It can be a number of things, but you can cope with those things. It can help if you establish a plan and a strategy. I think about mental health, the capacity to think and feel a certain way to enjoy life. And also, a good mental health is that you deal with the challenges. You don't mask them and hide them. And then we have in the second column our issues. In the last column, our mental health conditions that has created, based on the issues, it's created depressions, anxiety, and other problems that affect our mood and how we feel or think about ourselves. So the goal is to create a strategy, a plan of action. But the good news, we have some good news. We talk a lot about mental health in not so positive way, because we think about mental health as being a big, overwhelming project that we have no solution to. But we do have solutions. We do have services like the agency that I recommend. That most people who are dealt with a mental health issue have a condition that they can live a healthy lifestyle. They can live it without ridicule or a stigma, because they can have therapy. Good news is that you can go to therapy. Good news is that you can have peer support. Good news is that you can take the medication prescribed to you. All of that working together, depending on what your professionals has mentioned to you, which is what you should do, could help you live a healthy and fulfilled life. Because the thing about it is, you have to develop a strategy. That's what we're talking about today, so that you're not overwhelmed, so that you can deal with the challenges that you're faced with. You must develop a strategy. And when you develop a strategy, you have action items. When I talked about the pyramid, you take action. Whatever's at the top, that's the goal, but you have to make a plan to reach that goal. Because a goal without the action steps is just fantasy. We're not living in a fantasy land. In order to get healthy, you have to participate in your own recovery. You must participate. And so here's a list of action plan items that you can take. Connect with other people. Be active. Set goals. That way, when you do this, this is not just fantasy. You're actually working. Exercise. Get out and they say smell the flowers. Walk around the block. Do something. Focus on the positive. Get some rest. Keep learning. Get a hobby. Maybe that'll relax you and change your mood. Don't be hiding behind the mask. Get some help. Don't just get yourself buried and become more buried over a situation that you feel is hopeless. Eat healthier. I know sometimes if I have too much sugar, even at my age, if I have too much sugar, I can feel a sugar rush, and it doesn't make me feel good. So sometimes eat healthy. Make a decision to deal with your challenges. Try to think about positive things you could do. Reduce clutter. That's, oh man, a lot of people, you can tell that they have a mental health issue because they have so much clutter around them. They hold on because they don't want to release. So I'm saying to you, these are action items you can take. And when you apply these action items, you can have a better mood. And some of this better mood will make you feel better about yourself, because you make yourself a priority. When you make yourself a priority, then you can do something better. You operate and participate in your own mental health wellness. If none of this works, seek professional help. It's okay that we go and seek professional help where they can tell us some things that we would need to do to improve our mental health situation. The whole goal is not to hide behind the mask. So right now, I tell you, stop, look at the stop sign, take a moment, and just think about yourself as a priority. Just stop life altogether. Think about yourself as a priority. What action steps can you take today? As I talked about the pyramid, making the goal at the top. It could be reduce clutter, put that at the top. It could be several things that you need to do to change your mood. When you change your mood, but you have to stop just being in a chaos, like the chaotic world. If you don't take care of yourself, nobody else will. When helping others, let's say helping others is a God-given gift that you have, and it brings you joy. But make sure that when you're helping others, that you also take time for yourself, because it is a benefit to serve others. But don't let other people steal your joy or your peace. Have you ever heard of the rule of five? The rule of five, I found this. I thought this was pretty interesting. The rule of five says will it matter for you in 5 years? In 5 years, if it doesn't matter, then why are you stressing about it today? So what I'm saying to you, you don't have to keep carrying around that 8-track tape player. You don't have to move clutter from the east side of the room to the west side of the room. Just get rid of it. If it's not going to be part of your life in 5 years, why are you doing it? If you have no If you are powerless over the outcome of a situation, why are you stressing about it today? If you've done all that you can do and you're powerless, let it go. Let it go. It may not be part of God's direction for your life or your motivation for your life. And if not, just let it go. Don't stress out about it. If you don't need it in 5 years, don't stress out about it for another 5 minutes. Let it go. Let it go. Turn around and let it go. So what I'm saying, the rule of five is that in 5 years, will it mean anything to you? And if not, just relax. Relax and live a happy and more healthy life. Have good mental health strategies in your life. Well, I'd like to thank you so very much for, as a recap, you made it through this presentation. Improve your health. Don't stuff your emotions. Do something about it. Take charge of yourself, and because we truly believe that you can do it, and you are congratulated in advance. My name is Dr. Simmons, and thank you so much for this is Free in One Training Institution, and I'd like to thank every administrator. Happy Administrative Professionals Day. That's what it is today. I don't know when you're watching this, but we can celebrate our administrative professionals every day. They support us and help us to get the job done. If you have any questions or need any more information, I am Dr. Simmons. I'm with Free in One Training Institute. We are available to provide staff development training in various subjects. If you need any training in any areas of housing first or conflict resolution, or topics like today, mental health training. We provide all of those trainings, and you can email me at fnotraining@gmail.com. Once again, that's fnotraining@gmail.com. Thank you so very much for letting me be of service, and you just have a fantastic day for the rest of your day. Thank you.